Hypertension is an outward sign of trouble in the circulatory system. It is capable of causing many problems and can lead to negative effects throughout the body. High blood pressure can lead to stroke, heart failure, kidney disease, eye damage, and many other problems. Keeping blood pressure in check is essential. Some common medications used and their side effects will be discussed throughout this video.
Diuretics, also called water pills, are medications designed to increase the amount of water and salt expelled from the body as urine. There are three types of diuretic medications. They are called thiazide, loop, and potassium-sparing diuretics. Thiazides are the most commonly prescribed diuretics. They're most often used to treat high blood pressure. These drugs not only decrease fluids, they also cause your blood vessels to relax. Thiazides are sometimes taken with other medications used to lower blood pressure. Loop diuretics are often used to treat heart failure. Potassium-sparing diuretics reduce fluid levels in your body without causing you to lose potassium, an important nutrient. The most common conditions treated with diuretics is high blood pressure. The drugs reduce the amount of fluid in your blood vessels, and this helps lower your blood pressure. When taken as prescribed, diuretics are generally well tolerated. However, they can still cause some side effects. These side effects could be too little potassium in the blood, too much potassium in the blood for potassium-sparing diuretics, low sodium levels, headaches, dizziness, thirst, increased blood sugar, muscle cramps, increased cholesterol, skin rash, gout, or diarrhea. Some of the more serious side effects include allergic reactions, kidney failure, irregular heartbeats. Diuretics can also affect blood potassium levels. If you take a thiazide diuretic, your potassium level can drop too low, causing hypokalemia, which can cause life-threatening problems with your heartbeat. If you're on a potassium-sparing diuretic, you can have too much potassium in your blood as well.
Beta blockers are a medication used to reduce cardiac output through lowering one's heart rate. Less cardiac output leads to lower blood pressure. This is accomplished by blocking one's beta-adrenergic receptors. The receptor is a folded protein that sits on the surface of cells. Its primary role is to respond to epinephrine and norepinephrine. Different adrenergic receptors are on the arteries, heart, and lungs. These play a role in blood pressures. When epi and norepinephrine bind to these receptors, they cause a variety of different outcomes. As demonstrated here, when epinephrine or norepinephrine bind to an artery, it causes the artery to vasoconstrict and equals a higher blood pressure. The opposite happens if a beta blocker attaches to the alpha-1 receptor. This blocks the ability for the norepinephrine or epinephrine to attach to the alpha-1 receptor and causes a decreased smooth muscle contraction and a lower blood pressure. When epinephrine or adrenaline or norepinephrine attach to the beta-1 receptor on the heart, it causes increased heart rate, increased contractibility, increased stroke volume, and cardiac output, ultimately leading to a higher blood pressure. If a beta blocker would bind to that same receptor, the norepinephrine and epinephrine cannot attach. The beta blocker causes the decrease in the heart rate, a lower stroke volume and cardiac output, and the blood pressure to decrease. When norepinephrine or epinephrine bind to the beta-2 receptor on the lungs, it causes smooth muscle relaxation and dilation and opening of the airways. If a beta blocker were to bind to the beta-2 receptor, it would cause vasoconstriction and shortness of breath. There are two types of beta blockers, selective and non-selective. Non-selective does not have a preference for the heart or lung receptors. This can be a bad thing because it can cause difficulty breathing. Some other side effects include hypotension, which could lead to dizziness, lightheadedness, and orthostatic hypotension. You could also have cold feet and hands due to poor circulation, fatigue, bronchospasms, and shortness of breath, as we seen earlier. Thoughts to keep in mind when taking a beta blocker include take as prescribed. Taking more or less can have dramatic effects on one's blood pressure. One should also consult a doctor before stopping the medication. Stopping or not taking it regularly can have dramatic effects on one's blood pressure and heart rate. They can also mask hyperglycemia, and people are unaware of how low their blood glucose levels actually are.
Calcium has a large role in how the heart works, and in turn, it affects blood pressure. Calcium works with the heart and its cells and enters the heart and the cells during each heartbeat. Calcium contributes to several things that control the heart's functions. Most importantly, calcium binds at the sinoatrial node, which controls electrical impulses in the cell that signal heart contractions. These contractions cause the heart to pump blood. For many people, more calcium can mean a stronger heart. But among several different genetic variants, high levels of calcium can be detrimental to the heart and blood pressure. High levels of calcium can cause the heart to overwork itself, causing it to contract too strongly. This, in turn, can raise blood pressure. This is where calcium channel blockers come in. These are basically drugs that lower blood pressure. Calcium channel blockers limit the amount of calcium that enters the cells of your heart and arteries. These channel blockers work to inhibit the sinoatrial node, slowing the electrical signals that initiate heartbeats. With less calcium around in the heart and arteries, the heart can relax a little bit. This causes the vessels and arteries to open and relax, allowing blood to flow through them with less work from the heart. Since these blockers open arteries, producing venous dilation, it decreases the pressure within, and thus the heart requires less oxygen to do its functions. Since the heart doesn't have to contract so strongly, this in turn lowers blood pressure. However, just like any drug that lowers blood pressure, calcium channel blockers can be detrimental to one's health. It can lower pressure too much, lower heart rate too much, cause drowsiness, and can create swelling in the legs and ankles, and several other unwanted side effects. This intervention needs to be monitored carefully to limit these unwanted effects.
So today I'm going to be doing my part of the presentation on ACE inhibitors, which are angiotensin converting enzyme inhibitors, which are designed to relax your veins and arteries to lower your blood pressure. And it stops your body from producing angiotensin 2, which you don't want because it makes the heart work harder than it needs to and releases hormones that cause your blood pressure to increase. And then in rare cases, ACE inhibitors can cause angioedema, which can happen in Black patients, women, and people who smoke. So another thing that can happen is throat swelling, which could obviously be fatal. And then non-steroidal anti-inflammatory drugs like Advil can decrease the effectiveness of inhibitors. And then also, but with the NSAIDs, it can depend because sometimes it won't affect ACE inhibitors, so you just need to talk to your doctor. And then it's not good for pregnant people either. It can affect the baby in the pregnancy, so you should also talk to your doctor if you're thinking about taking ACE inhibitors for blood pressure with that. Okay, and then side effects are dry cough, hyperkalemia, fatigue, dizziness from blood pressure going low, headaches, and loss of taste. And who would use this medication? It depends on the health of the person. People with chronic kidney disease may use it. And then ACE inhibitors also help with coronary artery disease, heart failure, diabetes, some chronic kidney diseases, heart attacks, and scleroderma, and then migraines. And a note about ACE inhibitors is that you should avoid taking them with angiotensin receptor blocker or direct renin inhibitor because that research shows that it can cause renal and vascular issues. And then these are my resources.